The ARJR Fellowship at HSS is simply the best of its kind. There's no other program that is going to give trainees the breadth of cases, the depth of training, the educational conferences, and the surgical experience that they will receive at HSS. Being a tertiary referral center for orthopedics, we're going to see everything. So the fellows, after they complete their fellowship here, will feel prepared to really handle any problem.
Our job here is really to train the next generation of leaders. That's why the fellowship is so critical for us here.
We definitely want fellows to be on the podium and to perform incredible research and to drive policy going forward. But first and foremost, our goal is to train the finest clinicians and surgeons in arthroplasty. Fellows are going to have incredible access to varieties of patients, different types of cases in arthroplasty, different surgical procedures. And finishing the program, they're going to feel well prepared to take care of the whole spectrum of disorders from primary hip to primary knee, to partial knee, to hip resurfacing, to infections, periprosthetic fractures, complex revisions. So they're really going to have the best training possible. A typical day for the fellows will start with seeing the patients in the hospital, some patients that they may have operated on, making rounds and then interacting with the team to come up with a plan for the day. Then there's going to usually be some sort of educational conference. So we have a variety of didactic lectures, small group conferences, bioskills labs, and journal clubs. Then they'll usually be heading to the operating room or to one of the office clinics with our attending staff.
Research for the fellows have been super important here at HSS, so much so that they have a dedicated time that's protected. The chiefs make sure that they have time that's set apart so that they can actually focus on the research that they're doing. They're not allowed to be in the OR, just to make sure that they have time and they have an opportunity to really delve into what's really important as it relates to their clinical research as well as their biomechanics research. We want to make sure that the fellows are actually assigned projects that they're interested in. One thing that I think is super important is the ability to combine clinical research with other areas, such as basic sciences as well as biomechanics. This allows the fellows an opportunity to have interdisciplinary research. This is something that's not necessarily available at other fellowships or other academic institutions, and it's really a gold standard that HSS has to offer.
When I came to HSS for fellowship, I had only written 4 papers. And for my institution, actually as a resident, that was a lot of papers. So coming here and seeing the immense research infrastructure, I was able to write 15 papers here as a fellow, and now I'm close to 90 publications in my first 6 years in practice. I was just recently inducted into the Hip Society, which is a very big honor, and I'm truly blessed to be surrounded by faculty and staff that has supported me throughout my career to help me get into such a prestigious society. Without having come here to HSS or being immersed in this type of environment, I don't know if I ever would have realized my true academic potential.
The characteristics that I'm looking for in a fellow is someone who is incredibly smart, has done well in their residency program, because that's the best indicator of success down the line. Whether they've taken advantage of the opportunities they had during their residency. Some residencies have a lot of opportunities, some have less. But I look at what did they do with the opportunities they had.
Conferencing at HSS, especially for the ARJR service, is very robust. So we have a weekly conference that's 30 minutes of case presentations presented by fellows where we discuss some findings about a patient and then the surgical treatment. Then there's going to be a didactic lecture usually given by one of the attending staff or biomechanics staff where we talk about some aspect of joint replacement surgery. That conference is given once a week. And then on the other days of the week, there are also small group sessions, fellows meeting with attendings to have some educational sessions either on the knee or the hip, journal clubs, radiographic review sessions, and then twice a month we have a psychomotor skills or bioskills lab in a cadaver where we will investigate different techniques and different technologies. Some of the clinics that ARJR fellows participate in is the Comprehensive Arthritis Program clinic. So that's where the fellow will actually take charge of the patients, be responsible for those patients, indicate them for surgery, perform the surgery. So the fellows will also do clinic time with Dr. Bostrom, Dr. Salvati, Dr. Ranawat, Dr. Skolko. They will be able to see the patients in the office with our attendings. We know how rewarding it can be to get graduated autonomy. So fellows, very quickly, they will move on to performing the cases and feeling confident in performing those cases.
The Adult Reconstruction Joint Replacement Fellowship is wonderful. The thing that has attracted me here to HSS would be very high clinical volume.
The Joint Replacement Service has 30-some attending surgeons on the service. That's as large as most orthopedic departments.
One of the advantages of fellowship at HSS is the depth of the service in terms of the variety of surgical techniques and practices. It exposes the fellows to different ways of operating.
There's a lot of surgeons that do things very differently, so it's good to see that diversity and complexity.
Another thing is the complexity of cases. We are one of the highest volume referral centers for all over the country, as well as different parts of the world, for these very complex cases throughout orthopedics.
Our department does about 1% of the nation's total hip and knee replacements, so there's definitely a lot to learn and a lot of great people to learn from.
Volume is certainly important for fellowship training. It's important to get those repetitions in there. So each fellow from ARJR is going to complete the year with over 600 cases, and 20% of those will be revision cases. And also different technologies that people utilize for arthroplasty. That's also a huge advantage. So some surgeons will use navigation, others won't, some will use robotics. So the fellow is going to get exposed to all of those different practice patterns.
You can use all systems that you want, which is something I wanted to see, because wherever I was going, I didn't know which hip or knee implant systems I'll be using. There's the resurfacing, which I didn't really know with Dr. Su, and I heard that he was doing them at a volume, but here you really get into it. There's different robots that you can use, or robots navigation.
There tends to be strong camaraderie amongst the fellows. They tend to be a very tight-knit group. They spend a lot of time together in the hospital, but then even outside the hospital, and they just tend to hang out together and enjoy New York City as a group. HSS facilitates that camaraderie by sponsoring different events amongst the ARJR attendings and fellows. So we usually have a fall mixer where significant others, the fellows, and the ARJR service will get together. We also sponsor mentorship dinners, so the mentors can take out their mentees. Then we'll also have events sprinkled throughout the year. For example, there are receptions at AAHKS, at AAOS, at CCJR.
Once they're part of the fellowship, they're always part of the fellowship. They will have access to the mentors, being able to run complex cases by them. They will often have access to our conferences as well after they leave here. And then their mentors here really want them to succeed in leadership roles across the country. We'll make sure that we have the HSS influence felt throughout the orthopedic world.